Thursday. When it comes to fighting breast cancer, the most effective weapon is early detection. Here to explain how quick and easy it is to get that mammogram, please welcome Dr. Shultz with Solis Mammography. Good morning. We have done such a great job of marking October as Breast Cancer Awareness Month that I think subconsciously we think if you didn't get your mammogram in October, then you have to wait till the next October, right? But a lot can happen within a year.
Yes, that's true. We recommend yearly screening because changes can happen and it can happen quickly. So yearly mammogram gives us enough time to assess any interval change and a significant change and detect breast cancer early.
Yeah, and there are different types of breast cancer. Some take off a lot quicker than others.
Correct. We were talking about inflammatory breast cancer, which is a locally advanced breast cancer that can happen rapidly. So definitely want to get your mammogram every year.
Yeah, a lot of us put it off because we're afraid of the results. But again, the early detection rate, if you have early detection, the survival rate is almost 100% now, right?
Breast cancer is a very treatable, curable, survivable disease, but the key is early detection. When we detect it when it's small, it hasn't spread anywhere, it's just small, localized, they can treat it and it's survivable.
Yeah, give us a reference of what small is, like about the size of a pea right here?
Right, so most mammograms will find breast cancer when it's the size of a pea or less, and way before you can feel it, whereas that if it's the size of a walnut, that's almost the size that the patient would feel. So that's much larger, greater chance of it spreading outside of the breast.
Yeah, and the time it takes to really do this, you can do it on your lunch hour.
Exactly. So getting a screening mammogram is really easy. I mean, you can call or you can go online and schedule your appointment, and then it takes about 45 minutes of your time. You go in, the actual mammogram takes 10 or 15 minutes. They do 2 pictures of each breast, and then you go on and you'll get the results shortly after that. And
then a lot of women go, oh, I don't want them squeezing, it could hurt, right? But it really, the one I've had is never uncomfortable.
Right,
so.
And I just had one recently too, and it's actually was not uncomfortable at all. It's light compression, and the mammography technologists at Solis are very well trained to get the best quality picture, but use the least amount of compression so that there's minimal discomfort to the patient.
Let's talk about those pictures and that mammography, because technology has changed. We have 3D mammographies today.
Exactly. So 3D mammography is a new technology which allows us to kind of page through the breast rather than just seeing a 2D image. We actually page through the breast, and it helps us detect early breast cancer. And it also helps us minimize the risk of false positives that we talked about earlier. So you're less likely to get called back, but it still increases the rate of cancer detection.
Yeah.
And it also mammograms give people peace of mind. And I think that's important because there's so much anxiety with the mammogram, and you think, oh my gosh, less than 10% of patients who have a screening mammogram are going to get called back. And if you do get called back, there's a high chance it's going to be a benign finding.
Yeah. And so, even if it is malignant, the key is if it's caught early. You're going to go through some stuff,
right?
But that you're going to get rid of it.
But it's important to know that 90% of the patients when they come in, they're not even going to get called back.
Yeah.
So definitely get it and promote your breast health.
Now I remember years ago, I had a mammography, and they saw something, and I went back in and they did an ultrasound. So it was not something they did for everybody. Is the 3D mammography just kind of the standard now that you all do?
Yes, it is. So I work for a group called Rose Imaging Specialists, and we partner with Solis. And our group actually was involved in some of the research that showed that 3D was effective. We were involved in publications, showed that 3D was the most effective tool in reducing your callbacks for negative things.
Right.
And for still detecting cancer and increasing our cancer detection.
All right. Well, thank you very much.
Thank you.
And by the way, we were talking about that month of October. If you can't get in October, you say you always go in what month?
I go in February because I have 4 kids, so I try to go to months that's not busy for me, not worried about the holidays, not worried about the summer. And we had
February because you love yourself.
Yeah, we had a promotion called Be Mindful of Your Mammo. So.
Wait, let me see if I heard you right. Did you say you have 4 kids?
Yes.
They all came out of your body?
Yes.
4 kids came out of the... And I had 1. What happened there? All right. To schedule your life-saving mammogram, give Solis a call at 866-717-2551, 866-717-2551, or visit them online at solismammo.com.